most common medical device questions that I get on LinkedIn, phone calls, text messages. I'm going to go over them today. It's going to be rapid fire. I'm going to read a question. I have them in my generator. I'll provide an answer. So get ready. This is round 2 of the most common medical device questions. First question: do you believe that the future of this field, of this industry, is heading in a positive or negative direction? I'm worried that the salaries and pay are at the low point, prices on products have gone down, and that quotas are staying consistent or rapidly increasing. Those are all good points. I'm in this industry, so I'm super bullish on the direction. I still think there's some roles as entry level pay extremely well, especially when you come after college with no previous job experience. And that would be anywhere from 80 to 120 salary plus full benefits, right? Car, healthcare, 401k. And, talking about ASPs or average selling price of devices going down, 100% true. But what are you going to do to make up for it, right? How are you going to sell more products? Is your company releasing new products that could capture a higher price? I'm not really worried about that. What excites me is when you look at this industry and the division, specifically cardiology, structural heart, and neurology, you see that the field is growing. There's new innovation being delivered to meet unmet needs in the field and provide patients and their families relief of symptoms and the extension of life. And that's really exciting. Specifically in structural heart, mitral disease with major symptoms, there's not a clear great solution. Mitral surgery is great, but what about minimally invasive? There's about 20 startups trying to figure out how to deliver that. That's going to be a really exciting product to represent. Starts with getting in the field now, and in 10 years try to get over there. Let's go to the second question. Is it easy to transfer locations within a company for the same role? 100%. If you're good, you're going to get transferred. And this is how it looks like, right? You start somewhere, you tell the hiring manager you're going to do great in training for the first year, you're going to contribute year 2, you want to be in this role year 3, year 4, and you either get into sales or field education. Unexpectedly, year 2, you realize that you have to move home to family, or you get married and you have to move somewhere else. That's fine. Life happens. You just have a conversation with your manager, and if you're a good employee, they're going to figure out a way to transfer you. Sometimes you need a spot to open, but if you have conversation saying, manager, in 6 months, it's looking like I'm going to have to move. What can I do to stay with this company? They're going to figure out how to get you in contact with the other hiring managers, especially if you're good and trained and have done right by the company, to help you find another role. Transferring can be difficult if you're not a good employee and they want you to naturally leave the company. They're not really going to facilitate that transfer, right? Let's go to question number 3. Do you think switching career fields into med device sales would pose a lot of barriers? For that question, I don't know where you're coming from, but I think med device from all my videos is super exciting, so it could give you a good idea of what this field offers. And the skills you need, you can learn. I'm never worried about the skills, but it's more so the character you bring, right? Because you're going to be in that room representing a patient, helping a doctor deliver a great result. Skills like communicating, cold calling, all that you can learn. Clinical anatomy, you can learn. Operating technique, OR, that's all stuff you can learn. And there's something from your previous role that you could bring that's going to help you kind of sell your story about why you can go into this role and succeed. Now, let's see what the next question is. What advice do you have for someone on how to build relationships with your team when you're all working, I don't even know the word, all working individually at different places, right? Especially in the field, right? So for example, CRM, the pacing team, every team member's in a different hospital working together, and training, you're always with someone, but once you're off by yourself, how autonomous work environment, how can you bridge those connections, right? And for me, that's really important. Being on a team, I'm a big team guy. So phone calls, best practices, reviewing with each other is really important. Trying to drop in, sometimes I'll be in the hospital doing the implants, my buddy's in the clinic doing, clinic coverage. I get done, instead of going right to my car, let me go over and see if he needs help, catch up, we'll have a couple of laughs. Stuff like that's important, right? And taking the opportunities to get a quick lunch, quick coffee in between cases, is always important. It does feel lonely, you're isolated, you're by yourself, but a good account manager, good district manager will build a really strong culture where that team is working close together. It does feel like you're far, but you're always just a phone call away. What is one reason you would not encourage someone to pursue a career in medical device sales? Specifically medical device sales and the field-based roles, if you're not comfortable with a variable schedule, be it starting early, ending late, then I would 100% not recommend this for you. If you like being able to clock in at 9, bust your ass off for 8 hours and clock out at 5, and you need that routine, do not come to medical device. The days are totally different. You never know what you're going to get into. You might be going on a date and you get a call from a doc that there's a case added and you're the primary coverage. You're going to have to cancel that date, reschedule, and get to surgery. If that freaks you out and you can't do that, this field is not for you. Days could be long, but on the flip side, some days are a little bit easier. Some days you start later, and those times you capture things that are important for you, be it grocery shopping, getting your laundry done, exercise. Every day is not a grind, but there is unpredictable days and longer days that can affect your schedule. So understanding that will set you up for success outside of work when you communicate your kind of responsibility to a spouse or your family. When I don't receive feedback from an interview, what's the best way to reflect on my performance and identify areas for improvement? I will assume that you ask for feedback. Hiring managers, they're not required to provide feedback. Some of them are super busy. But if you do it in an appropriate way to ask for feedback, it could establish a long-term relationship. I see this issue a lot with people coming right after college, trying to get right into med device. It doesn't happen that way. It's a very small industry. So let's say you interview with me today and I went with someone else that was already talking to our team. I think it's going to be a great candidate. It doesn't mean that you're not a great candidate or that we don't like you, but right now we only had one spot. If you stay in touch or if you ask for feedback, when the next role opens in 6 months, it's like, this person was great. Like, this is an obvious answer. Let's see what the candidate pool is, but this person's already top of my list. And that only happens if you maintain relationship and follow up. When looking back on how to improve, if you don't get feedback, it's a little bit difficult, right? If you're really self-aware, you could identify, and I could give you an example of how I interviewed with a VP of sales and totally bombed the interview. And when I asked for the next steps, it absolutely got shut down. And before that, I knew that we weren't going that direction, and I probably shouldn't have asked. Doesn't hurt to ask, but you could just tell that the questions got really short and the interview just tanked. But I don't know if you're recording your interviews, but I would self-reflect and think about what you could have done better. It's hard to know if you don't get feedback. I also like to let people know that sometimes companies post roles with someone already identified, such as an internal candidate. They still need to post for HR reasons. And that's frustrating because you might apply, interview, and they're already 99% of the time have the person identified. So it's kind of a waste of your time and you don't even know that. So keep applying, always keep improving, of course. Over time, over summer specifically, I spent time networking with professionals and sales reps in an industry. Should I wait until closer to graduation to reconnect, or is it better to continue maintaining those relationships now so that I stay top of mind? What does maintaining a relationship look like? That is a really good question. And I like to approach relationships or networking not as a CRM because it makes me feel like a robot. I really want it to be organic. But I would always follow up, especially with hiring managers. If you do an internship, I would stay really close to them every month. Maybe you meet with a VP of sales, maybe every quarter you find a way to shoot a text or an update. And typically in med device, for example, if a role opens, they're looking to hire that and fill in 2 to 4 weeks, right? So if you're, let's say, a senior and you're going into your last semester and it's only winter break, they're not going to be too interested in hiring you because you have to get through your finals in May and it's 5 months out, right? But yes, still maintain your network. Never push on, I wouldn't worry about bugging them, just shoot them appropriate updates. And what does maintaining a relationship look like? I think it's a case-by-case basis, right? If I talk to a hiring manager, what I'd like to do is send updates that add value. Hey, hiring manager, we meant to talk about pacing. I loved our conversation. I never knew about this field. Thank you so much. First follow-up. Second follow-up, maybe 4 weeks later. I love pacing so much. I knew you said EKG interpretation is super important. So I bought a book called Dubin's and I learned how to interpret EKGs. Not as good as a doc, but I think I'm getting pretty close. That lets, and that's follow up too, that lets the hiring manager, oh, like Matt has the initiative to go find, to go learn, and he knows what's important. 4 weeks after that, for follow-up 3, maybe I follow up on EKGs and send a picture, say, hey, I saw this one. This one's really complicated. How would you approach it? Maybe I follow up with, still love this role, would love to connect with anyone and see if I could shadow or learn more. In doing that, shows that you're eager, and when the opportunity rises, that you're going to be top of mind, top of list. Next question. Is there a product or department you recommend for someone coming from a business college without a medical background? And are there some clear distinctions in medtech sales between the US and Europe? That is a convoluted question. So product or department within med device sales, and if I don't answer this the way you want it, I'm sorry, but clinical knowledge, medical background is super important, but it's not necessary. A lot of the stuff you will learn. The great companies have a really great training on the sales side and on the clinical side. So I would never learn about that, but you do have the skills, be it what you reference as a business college, to learn how to write and how to prepare for exams. So if you were interviewing for a specific clinical role, you know how to find those information and prepare. So if you were looking at TAVR, you could find resources on TAVR, structural heart, cardiac disease, aortic stenosis, and try to learn as much as you can. Physicians and other reps have been in this for years, decades, so that obviously they're going to have an advantage with their knowledge, but you can still show the ability to learn, right? And I think what's more important is not so much the medical background, but understanding what would excite you, right? I mean, med device, there's so many different roles. You could sell neuro devices to help with the brain, diabetic machines to help people with diabetes. You could sell ortho from the knee to the hip to the face. You could do cardiology. I've talked a lot about ablation, pacemakers, structural heart. There's so many different fields, and you could approach it from whatever lens you want. Maybe you want to make the most money, which I would never recommend. So you pick a field that has the most earning potential. I would pick one that you find exciting, that's growing, that's innovating, and you bring the skills in your story to do well. And medtech sales between the US and Europe was the second part of this question. A huge difference. That I would let someone else answer. I think, I'm more familiar with the US market with, a traditional sales rep managing the account. A lot of my buddies have gone to Europe in product management roles or sales rep roles. The way they do field sales is very different. So something just to be mindful of. But working in Europe as a US citizen, that would be super cool. I encourage that. How should I weigh the decision between accepting the first offer I receive, especially knowing that breaking into the industry can be really challenging, versus waiting for an opportunity that may be better aligned with my long-term goals? Oh man, if you ask that question to anyone, I hope they put it back on you. Only you can answer that question. And I hear what you're saying, and it's something you just get in your gut. I don't think because what's going to happen is you're going to try to create a way to evaluate this offer and what to do, and it's going to stress multiple days trying to figure out what to do. I think it's just a gut feeling. What I want to say is you don't need to get it right. Sometimes a career path can be diagonal as you move to the perfect role. Any step forward with an offer is great if you feel like it's a great culture, great leader, and a great product. For me, I'm looking for a product that's clinically backed, that I really believe in, and a great manager. From there, I know they can take my career and really accelerate it. And there's other things to consider, quality of life, money, all that. But really, for my first job, I'm looking for a great training, great foundation. And after a year, 2, 3, either continue as a leader at that company or spin off into something that's more aligned with what I want. It's like a funnel, right? I don't know what you meant by aligned, but if you say geographically, I only want to work in Los Angeles, you're going to reduce the amount of opportunities opposed if you're open to all the United States, right? So something just to consider. What does it take to be successful in medical device as a lifelong career? I think that's such a good question. I think everyone you talk to is going to have a really great answer and a very different answer. For me, I went to UCLA, so I'm a huge John Wooden. He talks a lot about character and how to approach like practice for basketball, approach, life. And the most important thing, we could talk about skills or experience, but for me, it's character, your skills you have, and experience, right? Your experience doesn't dictate the future. Your skills are good, but they got to be applicable. And then your character, I mean, that's what people remember, right? That's going to build your reputation and who you are. And we could go more in depth about what, good character in med device is, but that's the thing that is most important for a successful med device career. If it's okay to make mistakes, but if you jeopardize your reputation or trust, it's going to affect you your whole career. It's a small community and people will remember. What tools did you use to study anatomy that is required for the role you broke in? I think there's so many great resources online. For example, medtronicacademy.com, specifically for the therapy you want to apply for. They're going to have great tutorials. There's a lot of outside tutorials on YouTube or Meditube where you can see actual procedures. So much of that stuff is accessible online. You don't need to go buy a $1,000 textbook, but just Google. There's great modules where you will be quizzed. Quiz yourself, learn, stay curious. And when you go into the interview, you don't have to be an expert, but just showing that you have the ability to find information, to try to learn it, to understand what's important to the hiring manager is the most important part. A few more questions as we round out round 2 of this questionnaire. Are there online courses I can take to get certified as a device technician? Specifically, I'm assuming for pacing. There are the IBHRE exams, which are great. It will certify you as a device technician or as a EP specialist. Those are really great. Typically, it costs $2,000 to $3,000 to sit for the exam. So that's expensive. So what I did was I got hired by Medtronic. I studied for it. They paid for my entrance exam. I passed the first time. It's a lot of studying. It's hard. And then also after they paid for it, they also gave me a raise because I was IBHRE certified. For general certificates, I see a lot of stuff online. I think it's all about opportunity cost. If you want to pursue a medical device training certificate or sales training course, just understand what are you getting out of it for what cost. If it's to help with networking or meet people, great. If it's because you don't have the time and you need structure, great. Specifically for this question though, for certification, IBHRE, super important. I would go after that. And what's the biggest difference between being successful as an associate versus taking the next step into a full sales rep role? So a lot of the ortho or neuro, you come in as an associate rep and then you could eventually take on the full sales rep role where you're managing all the ATMs. My experience was I was a clinical specialist. Typically there's 2 to 4 clinical specialists to 1 territory manager. So I'll speak a little bit about that, even though it's a little bit different terminology. As a clinical specialist, you're supporting really great cases. And a lot of times hiring managers don't want to bring their clinical specialists over to territory managers because they think they're cut from a different cloth. And 2, you're losing a really great clinical support that drives the business to put them in a rep role. But if you're trying to grow into that rep role, think about as a clinical specialist, what growth opportunities you can take. And it'll be identifying what makes reps good, right? Their sales, driving business, what is it? So work with your hiring manager to find ways to grow into that role so you become the obvious hire. Make it so difficult for them not to hire you when someone leaves or there's an expansion by doing things like asking for accounts that you could grow. Say, hey, your sales rep, what are you doing? What are your thoughts on me taking these accounts? You've been focused on these. Can I try for the next 6 months to try to grow business with this competitive doctor? Stuff like that. So then when the opportunity comes, you could share what you did. You could say, hey, I drove business at this hospital. First 2 months was difficult. Month 3, I had a breakthrough, couple cases. Month 4, 5, we found value and he started using us more and more. That's going to be huge, right? Clinical specialist, being a clinical expert, that doesn't mean you're going to be a great rep. It's a totally different skill set. So work with your rep to understand what differentiates them. Talk to the most successful reps and kind of follow that pathway, right? How to be successful after you get the offer and into the position. What to do, what to avoid. This will be the last question for today. I think it's a really good question. So you let's say you get hired by Boston Scientific as the ablation specialist. They're a great company, great training program. They're going to have your year set. They probably think the first year is all training. Year 2, you'll be doing some cases and contributing. In year 3, you'll be really adding value. So yeah, you could just follow training for the year and call it. You'll probably be okay. But how to really set yourself apart would be every single day, getting into cases and seeing unusual things so that when you are by yourself, you know how to troubleshoot those cases. Work with competitive doctors, work with doctors that are more supportive of your company. You know, you're going to be like, oh man, my manager said I could take this whole week to do the HR courses. You can. Or what you could do is say, hey, Territory A, I saw you have a case Monday, Wednesday. Can I join you for those cases? I would love to learn. I'll be quiet. I just want to pick your brain. Tuesday, Thursday, Territory B. Hey, can I get out there and see those cases? Friday, Territory C. Hey, can I get there other case? When you're done with cases, do the admin trainings, right? Do the HR trainings, do the modules about your therapy. The more cases you see, the better the training is going to go. That's the biggest thing. Even if it's 2 hours away, get out there and go see the case. I know when you join a new company and you're training, it sucks because you don't have your routine. And if you haven't been in med device, you don't know what I'm talking about. But usually you join a new team, new company, new product, you're going to be hustling during training to learn all about it, then settle into your territory and, basically be a little bit more comfortable. But when you shadow cases, you're also working with your teammates, right? So you're developing those relationships and you're also learning from them how they approach different situations. And Territory A has a great way and they think it's the best. You go to Territory B and they think Territory B's way is the best. You learn from them. Territory C is the best. You learn from them, right? You see the pattern. And then you acknowledge that they're the best. And then when you're fully trained, you could take a piece of everyone's to create your way, right? So I created the Matt way from the best of Territory A, the best of Territory B, the best of Territory C. And I also formed really strong relationships with those people that over decades I could call upon for different things. Hey, can you help me here? Can you help me get introduced to this doctor? Stuff like that. So by getting out there and seeing cases, you're learning for your own training and for that year to really set yourself apart. But you also develop really strong relationship for your career. And to finish, you asked what not to do. I think I told you what to do. I think what not to do is don't, be cocky. You're still learning. Everyone's learning. Medicine can be a really hard teacher when things go wrong. And it's not a perfect science, right? So always stay curious. You don't know everything. I still don't know everything, but I'm eager to learn from people, from physicians. And the other thing is not to lie, right? So if you can't make a case because you have to go drop your kid off at school and you say, hey, I'm going to go join Territory B, and you tell Territory B you're joining Territory A, and you kind of make up a story and they find out because they talk to each other all day, that's going to come back to you, right? So don't lie. Just say, hey, dude, I was planning on there's an emergency. I got to take my daughter to school. I'm going to come back and do training. Is there a way I could shadow you tomorrow? That's how I would do it. This is rapid fire medical device questions. A lot of really great questions. Thank you for submitting these. Stay tuned. We'll do round 3 soon. If you have any questions you want me to answer, shoot me a text or chat. I always check and I always get back. Medical Device Matt, stay tuned for more.